In Glasgow, operates four main services. The first service we operate is an information base. We operate a drop-in service for people in the area to come in, use the library of resources. We have DVDs, we have videos. People can come in, and people that use the centre vary from parents, professionals, carers, a whole range of people. In addition, we also have 4 public access PCs. And these are used a lot by service users, adults on the spectrum who come in. We've just had someone who's completed a master's at the centre itself. We have people coming in to do job search. People come in because it's a place they feel very safe. Sometimes you walk in and there may be people asleep in one corner, people working all over the floor, all sorts of places. But it is a place where people feel safe. And that's very important because one of the things, and I think the video highlighted it as well, is people don't feel safe in other services, and it's very important that a space is created where people feel able to be themselves. We also have a full-time information officer based there who's able to answer telephone, email and other inquiries as necessary. One of the biggest parts that the ARC does, one of the biggest parts of their work, is in training. Every year we train roughly around 1,500 people in a wide range of levels to help them work with people on the spectrum. Our training is offered to professionals, to parents, to carers, and we offer that at a different levels, ranging from one day basic autism awareness to taking that training out and delivering it in an organisational context through advanced autism training, whereby we offer a 9.5-day programme, right up to diagnostic training, which we offer right across Scotland. We're the only registered providers of the disco training outside of Elliot House, which is run by the MES. The other large part of our service is the adult autism team itself. We host a diagnostic team made up of clinicians from the NHS, offering diagnosis to adults aged 16 plus across the Greater Glasgow region. In addition, they will work post-diagnostically with some people, providing ongoing support, helping them come to terms with their diagnosis, and helping them get a better understanding of what their needs will be and how they may develop mechanisms to cope with that in the future. They also work with care providers, so we will provide training for care providers working with individuals on the spectrum, helping them ensure that their care plans and their packages are tailor-made to the needs of those people that they'll be working with. And I suppose finally, we also offer a number of sort of group and individual specific interventions for people. We run art groups, drama groups. I also commission a number of organisations to deliver social groups across the region. But knowing how much these services cost really does re-emphasise to me actually the benefits of them and the low cost that they are for services. And I also unfortunately see the other end of things when things go wrong in my capacity, and I know how terribly distressing it is for the individuals concerned and for families, and how the cost of that to society and the individuals themselves is huge in comparison to where we are able to intervene at an early level. The fourth part of what we do is we also offer assistance in strategic planning. I've just recently been involved in a 4-year strategy for ASD across the Glasgow region. But in also ensuring that all services are starting to develop some services and trying to develop effective responses to those people on the spectrum. Just to give you a brief outline of some of our activity. We opened probably around the early part of 2005. We've had around 8,000 visitors to the centre. We train, as I said, around 1,500 people a year. The majority of that is in basic autism training, though we are trying to develop that as time goes on, and to developing much more on a service plan basis, working with services, looking at their needs, who needs to be trained and to what level across services. We've also developed networks of linked practitioners for those people with enhanced knowledge who work within the learning disability services. We're hoping to recreate that in criminal justice services, in mental health services. We've also trained around 50 people in DISCO, which is a diagnostic tool. And as I said already, we've had over 700 referrals to the service. We've been pretty busy, but we have plans to be a lot busier, and I hope we continue to be able to do that. I was asked today to give you sort of one more concrete example of the work we've been doing. And we've been doing a lot of work around criminal justice. When we set up the criminal justice group, it had a key function. And that key function was to work with the police, with the prison service, the Procurator Fiscal Service, with social work, the NHS, to ask them to look at their services, to ask them to say, are you in contact with people with ASD? If you are you making an appropriate response? If not, how can that response be better? We brought a group of quite senior professionals from those services together, and what we did was, one of the things we have successfully done is developed a coherent training plan. Now in a minute we're going to see a police training DVD, which has been hopefully, touch wood, seen by most, if not all, police officers across the Strathclyde police region. In conjunction with that, there was an autism alert card which we developed, which if people are interested in getting, there's a leaflet, I think it was on the table as you came in, if not it might be in your packs. But please pick up the leaflet, and we hold those cards, so if people want to contact us to get hold of a card, you're more than welcome. Before we look at the DVD, and it's probably worth talking a little bit about some of the other work we've been doing in criminal justice services. We did a small piece of research in Barlinnie. We screened 80 prisoners within the service, 40 in mainstream prison, 40 in the high dependency unit. We found a prevalence in mainstream prison of 7.5% and a prevalence in the high dependency unit of 14.5%. I'm sure you'll agree, given that prevalence in general population was only 1%, how on earth are all these people in prison? We have a big task ahead of us. There are many, many adults, because their needs are not being met, ending up unnecessarily in the criminal justice system. It's something that needs to change. We need to provide early support, early intervention, early diagnosis, appropriate assessment. All those people we looked at, none of them were diagnosed. It could have been a whole different story if they'd received a diagnosis by the age of 3 or 4. The cost of someone being in prison, the cost of 7.5% of the prison population being on the spectrum is pretty much the cost of running a whole Scottish prison. If we could shut one whole Scottish prison, the cost savings would be incredible. We do need to get a lot better at what we do. So to return to where I started, I think autism presents us with a unique challenge, and it needs a unique response. We need to get much better in delivering services to people on the spectrum. The I Exist report highlights numbers of things, as Mark said, which are very, very important. We need to know numbers. We need people to get appropriate assessments. Staff need to be trained. And people need appropriate low-tariff interventions which can make real differences to their lives. In Glasgow, we've sought to take one foot on that long path. We've still much to do, but I hope we've made a good start.